I saw a constituent last Friday, a 37-year-old man with Parkinson's disease who had gone through a PIP assessment, and the assessment report throughout had described him as it rather than him. Does he agree with me that that's an example of exactly how that is not being put into practice under this scheme?
Frankly, it's absolutely sickening, and you know, it should reduce all of us to shame in this place.
Debate and follow the honourable member. I want to use the opportunity to describe the experience of one of my constituents who came to see me because of her concern and frustration about the Fit for Work scheme that's referred to in the motion before the House today. My constituent is a highly trained occupational therapist with decades of experience, and she was employed by Fit for Work, the company under the umbrella of Health Management Limited, which is part of Maximus, the company that the government has awarded a lucrative contract to work with people with disabilities to get them back into work. And when the Secretary of State was the Secretary of State for Wales, he made the announcement that the Fit for Work service was to be provided in Wales. And the service was to provide support and advice to employed people if they had been or were likely to be off work for 4 weeks or more. According to government statistics, about 48,000 Welsh workers a year are off sick for that length of time, and Fit for Work was to be gradually rolled out across Wales and England. And it was seen as a particularly important scheme in Wales, where there is a higher than average proportion of the workforce employed in smaller companies which don't have occupational health services to support absent staff. And the then Welsh Secretary said, the initiative will give tens of thousands of people across Wales the support they need to return to their jobs more quickly, and this is clearly good for the Welsh economy. So GPs in Wales were to offer patients a referral to the service, which included an in-depth assessment, followed by a personal return-to-work plan and managed support to get back to their jobs. That was in June 2015. My constituent came to see me because, as she puts it, she was concerned both as an employee of Fit to Work and as a taxpayer about how that contract was being delivered. She started working for Fit for Work in November 2015, just a few months after the Secretary of State's announcement, at the centre in Nantgarw, which is in the constituency of the Shadow Secretary of State. But by April 2016, Fit for Work were making staff redundant because they had insufficient referrals of clients, and the centre was then closed. She asked me why the government were not supporting a service that it had instigated. Just 12 months after starting the scheme, the public, GPs and employers didn't appear to know about the scheme or on any kind of meaningful scale. It was inadequately advertised, so there was little wonder that the number of referrals were too low. She told me that Fit for Work did only a few employer engagement activities. The implementation was poorly managed and badly promoted. And it even got to the stage where highly qualified medical assessors, case managers like her, were taken off assessments with clients and told to ring round employers to tout the service. Fit for Work had predicated 13,500 referrals a month, but were in fact only getting around 450. Not only had it been badly advertised and implemented, but the actual process that case managers carried out wasn't effective in helping people achieve the aims of the scheme. She described it to me as very standardised, very commoditised, and speed and light touch was its hallmark. The assessments were expected to be done in a very strict way, which had the effect of diluting the wealth of professional experience that she could actually bring to that role. Assessors were expected to complete 6 assessments a day. She told me that she struggled to even do 2 or 3 properly because of the amount of time it took. Everything is done over the telephone. Calls are meant to take 45 minutes. And the referrals were supposed to be for people who had, for example, back pain, depression or anxiety and had been off work for 4 weeks. But some of those people being referred had been off work for 2 years, and their problems were much, much more complex. And I was just thinking about how you would try and gain in 45 minutes not only the trust of the person that you were speaking to, but to be able to get sufficient information to properly understand their condition and the context that they were living in. To do the assessment properly, my constituent felt it required preparation, which obviously included reading all the information from the employer and the GP, making the telephone call, gathering the information from the client, considering all of that evidence, considering what a return to work plan might look like, transcribing that information and giving recommendations and an opinion within the production of that return to work plan. And she told me that to do it properly, it would take 3 hours. So the targets that had been set by Fit for Work had the effect of removing much of her clinical judgment from the process so that she could get the number of reports done, the target she'd been set. Fit for Work auditors would listen in on the calls with clients, and they would tell the case manager whether the call that they had done had passed or failed the requirements of the process, not whether or not it actually was delivering a proper return to work plan. It was very difficult to pass this test. She described the scheme and its implementation as being entirely data-driven rather than people-driven. And yet the Secretary of State said laudably on his appointment that he wanted to ensure that his department realised that there was a human being behind every DWP number. And this direct account from someone who was employed to deliver his department's scheme flies in the face of that. My constituent left me with a message for the Secretary of State. She says that she is really convinced of the need for this service. It could help a lot of people find ways to get the right help and get back into work sooner after illness or injury. But her team, a fantastic group of highly skilled, empathetic and knowledgeable health professionals who had very many valuable strengths and experiences to make people's health and well-being better and allowing them to return to work at a time that was right to them, was not utilised. They lost their jobs, the centre was closed, and that support did not materialise.
Debbie Abrahams.
Thank you, Mr. Deputy